Good evening, and welcome to the Forum on Food Insecurity that is co-sponsored by the League of Women Voters, Shaker Chapter, and the Greater Cleveland Food Bank. And I'm Mary LaVigne-Butler, and I get to split between both organizations because I'm co-chair of the Shaker Chapter along with Laura Creed, who's over here, and I also work at the food bank. So we're thrilled that you're here, and we think tonight's going to be a very interesting forum and presentation, and we've got lots of people here who are experts in their area, and we've got lots of community people who are doing amazing things in Shaker with respect to food insecurity and making sure that folks have food and meals. So we'll go from there. I'm going to introduce the panel. We had a couple last-minute cancellations because of things that have come up, so pardon us, we're going to wing it on some things, okay? So it's just going to have to be the way it is. So Loren Anthes, Loren is with the Center for Community Solutions, and Loren's going to talk about the role of the federal and state government with respect to hunger, and also the role of food and health with respect to the whole issue of hunger. Then we have Kimmy LoVano, who is the Director of Advocacy for the Greater Cleveland Food Bank. And Kimmy's going to talk about how the food bank really works in Northeast Ohio. That is where the rubber hits the road, because the food bank does amazing work in this community and in the 6 counties surrounding it. Keith Langford, who is with the schools, can't make it. So I'm going to be standing in for Keith only, but I'm going to be reading his talking points, and then I'm going to give you his email, because if you have questions, I won't be able to answer them, but you can email Keith in the morning. And then Nancy Moore, where's Nancy? There she is from Shaker City Council. Thank you so much for being here. We really appreciate it. And then we have Amy, and Amy, how do I pronounce your last name? Buthelette. Amy and another, who's? And they, I don't know if you know about the Free Little Pantry. They're going to talk about the Free Little Pantry, which is wonderful, and it's right behind the Heights Christian Church, and there's food there for anybody in the community that needs it. And then in addition to the panel, we have a couple folks in the audience who are going to help us along with some of the wonderful work they've done. We have Stacy Wren, who is a volunteer with the Shaker Schools, and then we have Nikki Crosby, who's a member of Heights Christian Church. And Heights Christian Church is doing some amazing work with community meals and things like that. So there's going to be a lot of new information for people tonight. So we're very excited about it. So, Roger Osgood, the minister at Heights Christian, couldn't be here, but he said, you've got Nikki. He goes, you're much better with her than me. So we said, okay, fine. We're happy to take it. So I'm going to turn over to Loren. And because we're filming this, Loren, you're going to have to use this microphone, but I think we've got a cord here.
Use the wireless one.
Oh, the wireless one. Okay, use the wireless one. There you go.
I think you turned it on.
Yeah.
Down. Should I put it up?
It's on. It's on.
It's on? Can you tap? Tap.
No.
I can go. Push it up.
Hello, hello, hello.
Thank you. Look at that. All right. Thank you very much. First of all, thanks to Mary and everyone with the League of Women Voters. Fantastic organization doing a lot of really good work, really important work. I'm a recovering state house employee, so when I was a legislative aide working for Tracy Hurd down in Columbus, we relied on the League of Women Voters for a lot of policy insights, and the fact that you're looking at things outside of, say, just the issue of voting is significant. It's also a particular sort of strange honor for me because, number one, I grew up in Shaker Heights, so I grew up on Ingleside and Van Aken, and then I lived Shaker Square, and then I also worked here as a page. So feel free to appropriate as much money to the library as possible, particularly the page line items of the library. So a little bit of background on me. My name, again, Loren Anthes. I work at the Center for Community Solutions. Anyone familiar with CCS? All right, a couple of you. So the Center for Community Solutions is a 115-year-old think tank that exists here in Cleveland, serves the greater Cleveland area, has been around since the progressive movement. We actually, in the 70s, we were the same organization as United Way, and we split off. They became sort of the United Way as you know it, doing programming, and we became sort of the planning part of it and kept the endowment. I think, personally, we won in that situation. But we focus in on health and human service issues, and I lead our work around Medicaid policy. So my background, again, is in state government. I've worked at the Ohio Department of Medicaid. I've worked for Providers, Metro Health, the Center for Families and Children, lots of centers in the city. I also had a cup of coffee right before I came here, so if I move quick, feel free to stop me. So what I want to try to do is just highlight some of the context here for Shaker and what we mean when we talk about food insecurity, where we are with policies on various levels of government and its relationship to health. I would definitely rely on Kim for more of the content expertise in food policy. But if there's anything you need from me, always feel free to follow up. I have my contact information here at the end. So the first thing I want to do is talk about what we mean when we say food insecurity. I really like this definition. It's when people at all times have physical and economic access to sufficient, safe, and nutritious food to meet their dietary needs and preferences for an active and healthy life. And the reason why I bring out this chart is, depending on where you are on the income scale, food insecurity is not immediately tied to money. You can be relatively doing well and still be food insecure, okay, because you may not have access, ready access to nutritious food. You may not have ready access to a grocery store. So this is where things like food deserts come into play. And so income isn't necessarily the best measure to determine food insecurity, but it's often what we use in a policy context to determine people's access for programs that help people address their issues with food insecurity. We do a lot of census-based research at the Center for Community Solutions, and I want to just pull this out from Shaker Heights specifically. There are about 5,000 people in Shaker Heights who live below 200% of the federal poverty level. So that is roughly around $18,000 or less per year per person, okay? So there's about 5,000 individuals who are at that level, and when we think about the number of people living below poverty or below the 200% level, that's significant because that often determines your access to a food pantry. When it comes to most programs, it's 200% or below. I think in Shaker, actually right now, the number of individuals who are using food stamps, otherwise known as the Supplemental Nutrition Assistance Program, or SNAP, there's about 1 in 10 people in Shaker Heights currently using SNAP. That does not include people that could be eligible for SNAP, so keep that in mind. Speaking of SNAP, the Supplemental Nutrition Assistance Program, it's about 1.4 million Ohioans, which is a lot less than what it used to be because of ways that we've changed eligibility conditions for the program. We've made it harder to qualify for the Supplemental Nutrition Assistance Program. I'm going to do this. It's worth about $170 million in economic input every month. And why does that matter? We're in an agricultural state, right? It's actually the largest industry, the second largest being healthcare, the third being manufacturing. So when you think about who benefits from this in the state, it's farmers, it's grocers, it's convenience stores, all of these folks who accept EBT, electronic benefit transfer, SNAP, benefit from this program. If you suddenly ended the program, you would lose that economic input. So you would lose the potential economic benefit from those dollars circulating in the economy. Your average Ohio household, too, is white. They are working. Usually 3 out of 4 households have more than one person who is working while also accessing SNAP. They tend to be single parents, mostly women, mothers. 1 in 2 have some level of disability. And 1 in 4 has someone over the age of 60. And the average benefit does not cover the full grocery budget. So I have a secondary role at Ohio University's Heritage College of Osteopathic Medicine, and I teach primary care, or aspiring primary care doctors. And one of the things we did is they went through their whole traditional medical school stuff around nutrition, and they talked about the SALT diet and hypertension and that sort of thing. And then I had them all participate in the food stamp challenge. Basically, I want all of you to spend a week only managing your nutrition through what would be the normal benefit, which is $4.12 a day. And then I said, and then come back to me and answer the question, would you still do the same thing with your patients who have these chronic diseases? And we also gave them a disease state. So someone who had hypertension, we're like, here's your $4.12, go buy your budget, or go buy your food with the budget and try to manage your diabetes. And they basically said, everything we're learning in the other part of the program is crap. It doesn't make any sense. And that's part of how SNAP was designed. It's supplemental. It's meant to supplement a grocery budget. So oftentimes people still rely on the food pantry even after they're accessing those benefits. Okay, one thing I want to highlight here is that food insecurity is an older adult issue. So if we think about it, 1 in 6 older adults in Ohio are currently food insecure. When you're food insecure, you tend to be more likely to have other health issues affect you, particularly for seniors. It's around depression. Social isolation is a big issue. Older adults visiting food pantries in Ohio has increased 20% between 2012 and 2017. This number is actually going up. I will say one thing about food insecurity. You can see here there's a heat map of who is accessing it. There's Shaker Hts right there. Interestingly, a lot of seniors, there's about 1 in 4 of the SNAP program recipients who are accessing these services are seniors. That number could probably be double based off of who is eligible. Seniors often don't go after these programs because it's taboo or there's some sort of cultural aspect to it, or there's some difficulty in trying to make sure that people sign up. But it is an older adult issue and it has systemic effects in terms of healthcare costs. I want to touch on the Older Americans Act. So it finances in the state of Ohio meals, not only home delivered meals, but congregate meals. Home delivered meals being exactly what they sound like for homebound individuals. Congregate meals being what they sound like, right? Meals in group settings. The money flows through the Western Reserve Area Agency on Aging locally. It's through the AAAs, as we call them, in the rest of the state. And you can see here that how these monies are divided. 55% of all the dollars that the state of Ohio receives goes to these meal programs. Okay. Some challenges associated with older adults. First of all, there's lots of waiting lists, staffing. When it comes to things like home delivered meals, that's volunteer based for the most part. You know, there aren't like people getting paid to do home deliveries. So there's oftentimes people are waiting. Also, one meal may not be enough. You know, I eat all the time. So, you know, for me, one meal may not work. Opportunities, though, there's other examples across the state, and we have a policy brief on this, where say like local restaurants have provided spaces for congregate meals and subsidized those meals to a certain percentage, and they partner with folks like food pantries and others to get that done. The reason why people should care, just from an economics lens, let's say like I don't care, or you know I'm cynical about these benefits, people need to do something else to earn them. Well, let me put it this way: 1 month worth of meals is worth 1 day in a nursing home admission. Okay, we know that nursing home admissions go way up when people are food insecure. So just by providing more food security, you're actually saving Medicare and Medicaid specifically more money. Also, 1 year of home delivered meals is less than 1 day in a hospital. Hospital admissions are also tied to food insecurity. So if you are food insecure, you're more likely to not be able to manage your chronic diseases, you're more likely to be depressed, you're more likely to be weak, and maybe you get up, you faint, you fall, you break a hip, right? These things are all interrelated. So fall prevention, you can see food security as a fall prevention strategy in a public health sense. So where is Ohio relative to the rest of the state? Ohio, we do well. Shaker, we do well. Well, Ohio does not so well when it comes to food access and food insecurity. Kids, right? Food insecurity as an issue for kids is particularly important because it's been shown to affect key developmental milestones with connections to behavioral health problems, school absenteeism, and poor academic performance. Also higher costs. Food insecurity is associated with higher incidence of chronic disease, nursing home admissions, and higher rates of diabetes-related hospitalizations. If, for example, it's cheaper to buy unhealthy food versus healthy food, or it's more readily accessible, that tends to be what people do. So that's just an important thing to keep in mind. So now where are the policy discussions across the state? Currently, the federal government is trying to, outside of law, but through rule, so through the administration function of the federal government, change the way in which people have to qualify for the program. Not only is SNAP a means-tested program, but it also has a work requirement. In counties where there are really high unemployment rates, those counties are exempt from that work requirement. Makes sense. If there are no jobs, we can't require you to do work, right? There are some counties, for example, in this list where literally job and family service departments are just having people sort blue caps and red caps for pens because they got nothing else for them to do. You can see here that the dark blue represents those that are exempt. The federal government wants to raise the amount of unemployment that's needed before you're exempt, and you can see here what that does is that limits it to 3 counties. So where Cuyahoga County currently is exempt from that work requirement, it would be unexempt, and thus 150, 200,000 people would suddenly have to go through an additional process in order to receive a food benefit. Other policy that's happening, House Bill 200. House Bill 200 would just eliminate the exemptions in the state of Ohio altogether, so no more exemptions. The Ohio Association of Food Banks in this budget currently received an additional $10 million appropriation from TANF, or the Temporary Assistance for Needy Families, which equates to about $1.20 per person, which at the food banks can go a really long way in terms of meals. Last thing I want to highlight here is the federal poverty level rule. So we talked before about how these programs are associated with income. The federal poverty level is a measure of income, and it basically, bases it off of 100%. So if you were at 100% of poverty, you're making around $10,500 a year as an individual. Maybe, $27,000, $28,000 for a family of three, probably less than that actually. What the federal government wants to do is they want to change the inflationary number associated with the federal poverty level. So let me get really nerdy and MBA-ish on you, okay? Because I spent a lot of money on that degree and the page salary wasn't covering it, and I'm just telling you, okay. So here's what happens. Let's say it's $10,500 this year. It's tied to consumer price index, right? It goes up by that percentage, and then next year it's $11,000, okay? What the federal government is saying is, well, we want to have it be tied to change CPI or some other sort of measure. So that $10,500 to $11,000 might be $10,500 to $10,750. Doesn't seem like a big deal. But if you think about it telescopically over time, right, you're talking about thousands and thousands of dollars of income that will be lost over time. So with wages not keeping pace with consumer price index, basically what you're doing is you're kicking out a lot of people on the program over time. Or you need to just raise wages so that people don't qualify in the first place. So that's being discussed by the federal government right now as well. They are taking public comment. So one thing that the League of Women Voters could consider, both in the context of their chapters and statewide, is writing to folks like Senator Portman, Senator Brown, and the federal government to suggest, hey, this may not be a good idea because we have, how many people live in Shaker Heights, Councilwoman?
20,500.
Okay, so we have about 1 in 5 residents who are food insecure. This will increase the 1 in 5 residents, and I believe most people would conceive of Shaker Heights as a relatively well-to-do area, right? So I think that that would be an important sort of thing to think about if you are interested in such advocacy. So with that, this is my contact information. Someone once told me this picture makes me look smug. I promise I'm not. But if you would like, feel free to email me with any questions you have. Go to our website. Our newsletter is super not annoying, right? We have an endowment, so we don't have memberships. We don't have advertisements. All of our information is free. I'm available as a resource, nonpartisan, nonprofit organization. So if you're not familiar with us and you want some of this information, feel free to reach out or sign up for a newsletter, and we'd be happy to help. So thank you. And I guess I'll turn it over to Kim.
And next is Kimmy LoVano. She's the Director of Advocacy at the Food Bank.
All right, so just as a quick overview of what I'm hoping to cover in the next few minutes, I wanted to talk a little bit about what the food bank does and who we are. A lot of folks think that we are a large food pantry that operates on the east side of Cleveland, but in reality, we are a large food distribution center. So I'll talk a little bit about that, how we operate within our 6-county service area, and how we operate within Shaker Heights. Then I'm going to talk a little bit more, I'm going to expand on what Loren talked about in regard to people that are in need in Shaker Heights. So where are people living that live below 200% of the poverty line that are eligible for food from food programs? And then finally, I'll talk a little bit about how you can get involved, especially in terms of advocacy and legislation that is on the horizon that could change how many kids in Shaker Heights are served. So there is really a direct way for all of us to get involved. So I wanted to start out, I do this before every presentation. Who here has been to the food bank before oh my goodness, that might be one of the highest hand raises I've ever seen. So great. So all of you probably have an idea of how we operate. For those of you who have not been to the food bank before, our mission is very simple. It's to ensure that everyone in our community has the nutritious food they need every day. And we do that through operating a large food distribution center. So like I said, most people think that we are a small program. We have 3 million pounds of food in our warehouse on any given day. We're 128,000 square feet. If you drive down 90, you can see us from the highway. That's usually the way, as soon as I say that, people are like, oh yeah, I've seen that sign. So if you come to our warehouse and walk around, within about 2 weeks, all of the food will be completely different that's on our shelves, even though it's 3 million pounds of food. And I say that just to kind of give a glimpse of how high the need still is in our community, even though the recession ended 10 years ago. So most people think Greater Cleveland Food Bank, we operate in Cleveland, but in reality, we operate in Cuyahoga County. We go out to Lake and Geauga counties. We stretch all the way to the Pennsylvania border, and we serve Ashtabula County. And then we go down to Ashland and Richland counties as well. And the way that we're able to do that, instead of making all of the people that we serve come all the way to the east side of Cleveland to get food, we partner with about 1,000 different programs within our 6-county service area. And I'll talk a little bit about some of those programs in a minute. But you can see it's a very diverse area. So we serve urban areas, we serve suburban areas, and we serve very rural areas. So the areas that we serve can be quite a bit different. In terms of how we operate, this is the part that it's always hard for us to talk about at the food bank because it takes a minute to explain how we work within our community. So food is donated by grocery stores, food manufacturers, community food drives. If anyone participates in Harvest for Hunger, if you go to Heinen's, Giant Eagle, Dave's, you'll see the Checkout Hunger when you go to check out. So things like that help us keep food in our warehouse. We get food donated through food manufacturers. A good way to explain it is, a few years ago we got a donation of purple Kraft mac and cheese boxes. And it was because they printed the boxes purple instead of blue. And like the Kraft mac and cheese jingle is, we've got the blues. So food banks were the recipient of that mistake. So in food banking for years and years, a lot of our donations have been kind of mistakes where the food is perfectly good, there's no difference. There's just a slight error and they don't want to sell it. For produce, it might be produce that has a scratch on it. You or I go to the grocery store, we try to buy it, and we kind of pass right over it. Food banks, people aren't picky if there's a scratch on their apple if they haven't eaten that day. So we're able to get all of that food. We also get food through government programs, which I'll talk about in a few minutes. We get programs through the state, which Loren mentioned. We just got a $5 million increase in the Senate. We're hoping it goes through. So we get food from a variety of different areas, and then money as well. So we're able to stretch dollars a lot farther than if you or I were to go to the grocery store and buy a can of beans. We're able to stretch that money a lot further. So all of that food comes to the food bank. After it comes to us, we have 18,000 volunteers. They go through it, they make sure it's safe, they make sure everything is good to go. And then similar to a bank where money is stored, we store food until it's needed. So we partner with our 1,000 partners. Good examples, I always like to describe it as we try to be where people are. So places like community centers, libraries, churches, schools, those are some of our biggest partners. And it's because that's where you find people, and that's where word of mouth kind of gets around for how you can get help. So if you look at some of the programs around your area in Shaker Heights, they're probably some of the programs that we partner with. So that food goes out, and then the direct result, we provide food indirectly to about 300,000 people within our 6-county service area on an annual basis. So that's also to say the need has not gone away. I can't express that enough, and that's something that I think a lot of us in this room, being in Northeast Ohio, that we've seen as well. So why does this all matter? The big question I always get when I talk about the food bank and how much we're doing is, well, who actually needs it, and where are people that need that help? So I keep getting really excited. I keep wanting to go forward. The easiest way to kind of explain over the past few years what the need has looked like is by looking, I have a sequence of 3 maps that really explore what poverty and what 200% of poverty looks like in Cuyahoga County. So the first map, this is 1999, and the blue on this map shows areas that the darker the blue, the more people that live below 200% of the poverty line in 1999. So you can see that it's mostly within Cleveland city limits. You can see it kind of spiking out a little bit in some of the inner ring suburbs, but mostly we're pretty confined within those city limits in Cleveland. Those green dots show programs that we partnered with back in 1999. So flash forward, recession hits. This is 2009. You can see that some of those blue areas where more people are eligible for emergency food from food pantries, hot meal sites, etc., you can see that blue is starting to move outwards. Inner ring suburbs, outer ring suburbs, both are affected. And then you can see the food bank, the green dots start popping up more. And then the last one.
Just point out where Shaker is on.
Oh yeah, sure. And I have a zoom in too of Shaker in a minute. But Shaker is right here. Okay, thank you. Yeah, good question. Yeah, it's a little bit tough to see. So this is 2019. So this is 10 years after the recession has ended. We often hear from people that unemployment is great. People shouldn't need help anymore. But at the food bank, at our programs, that is not what we've seen. As I said, we serve 300,000 people a year. We have not seen that need go down. And when you look at the data and who is eligible, you can really see that truth. So you can see the need in Shaker Heights, and I'll zoom in a second, has started to ripple out. Places like my hometown of Parma has started to, you can see pockets of need popping up, more people eligible for food. In some of the outer ring suburbs that people didn't anticipate would need help. Areas like Pepper Pike, Orange, North Royalton, Strongsville. When I sat in our help center where people call when they need help, I remember in 2012, we just started getting call after call after call of people from outer ring suburbs that they've never been in poverty before. They weren't really sure where to go or what to do. So this is something that we've seen firsthand, and then something that we also see in the data. Now, when it comes to Shaker, I've highlighted in yellow right here where Shaker Heights is. This is also some of the surrounding communities of Shaker Heights. So the same is true for this. The darker the blue, the higher the population of people who are eligible for emergency food assistance. You can see right here is Chagrin. Just south of Chagrin is where the need is highest. You can see the darkest blue areas pop up there. You can see there's a few dots on here. We partner with 9 programs in Shaker Heights to provide food to people, children, seniors, and adults. But one thing that I wanted to point out that talks a little bit more on the policy side, one thing that you will not see if you look at this map is programs that serve kids after school and during the summer. So within the Shaker Heights boundary there are no programs that serve kids after school or during the summer months, any kid in the community that needs help. There are no open sites. And the reason for that is federal legislation. So for any site that wants to open, they have to be within a school district where at least 50% of the kids are eligible for free and reduced price lunch. That's 185% of the poverty line. Now, within Lomont's school district area, it's 46%. So it just misses being eligible for sites to open. And you can see there's a few areas as well. The next highest, I have it written down, so I'll look after, but there were a few others that were in the 35, 36% range. So that is one piece of legislation that impacts the fact that all of these kids are not able to get after school meals through the food bank and summer meals through the food bank. And that's something that is on the horizon. So I'll talk in a minute about how you can get involved in some advocacy work to make sure that that no longer happens. So who is eligible for emergency food in Shaker Heights? This is just a small graph that shows who falls below 200% of poverty. Children, kids under the age of 18, 1,300 kids in Shaker Heights are eligible for food from food programs, and none of these kids can access after-school meals or summer meals. So I thought that was interesting. Adults, ages 18 to 64, more than 2,700 adults are eligible for food in Shaker Heights, and then more than 800 seniors. And that is a number that we will only continue to see grow with the population aging more in Ohio and incomes not changing once people are retired. And as Loren said, about 5,000 people in Shaker Heights are eligible for food, and that's about 18% of the population. So one thing, a lot of people don't know that we have a help center at the food bank. This is something that if you work with anyone who may need help, if you yourself need help, family members, friends, this is a great phone number to give out. I have it down here. It's 216-738-2067. If you go to our website, greaterclevelandfoodbank.org, you can also find it there. But our help center, we can help people apply for programs like the Supplemental Nutrition Assistance Program, formerly known as SNAP, formerly known as food stamps, also known as SNAP. We can help people apply right over the phone. We can also tell people where in their area, if they tell us their address, we can tell them, at 3 to 5 p.m. today, we have a program. It's open. You can go there to get food. You can take this bus line or this rapid to get there, and it's open again next week. So we can tell them where in their area there are programs that partner with us. So for those of you in the room, I know there's some folks who don't partner with us that still give food out, but this is a good starting point, and then we can build upon that. And then finally, ways to get involved. I have cards in the back that say Food Bank Advocacy Action Network. They're little cards that ask for your name, address, and email address. If you are interested in what I was talking about when it comes to more kids being served in Shaker, I can update you as things move on. So one thing, it's looking like in 2019, so by the end of September, or in 2020, that rule about the amount of kids that have to be eligible for free and reduced price lunches, there's potential for it to change. And so we are going to be pushing very hard for it to change. We're going to be working with all of our federal legislators. It would be 1,000 times more impactful to hear from people that it would actually affect and communities that it would affect. And there are so many more kids in Ohio in general that could be served if that guideline changed. And it's one line. I mean, it's a very small guideline, and there's a lot of interest to change it. So I think it just takes a lot of our voices to make that clear. And as Loren said, if we can add, we know that X number more kids in Shaker would be eligible, that's where things start to get more impactful. So if you fill one of those out and leave it with me, I can keep you updated as things move on. Another thing, visit our warehouse. If you've not been there before, come out and see it. We give tours all the time. We can walk you around and talk about our programs. And then finally, we have a speakers bureau. So if you're interested in diving a little bit more into this, hearing more about what the food bank does or what food insecurity looks like, you can invite someone from our speakers bureau to come out and speak. I have my email address on there, and then my colleague Noel, who's in the back, I will make sure that you get connected to him, and he manages our group of wonderful speakers. So on that note, I'm going to pass it along. Nancy, all right.
And I would like to just say a word while Roeder is coming up here. Trey has made a very hurried flight from Midway in Chicago and actually made it on time. Come on up, Trey. I'll just begin while he's coming here. I wanted to tell you that I spoke with, I spoke with many people in the city of Shaker Heights who are much more knowledgeable about the dimensions of hunger than I was. I have a person-to-person contact, especially with seniors, but I wanted to run through many of our initiatives are regional and collaborative, and I just want to, Trey will elaborate on any that he's been involved with. The one that I have the most respect for is the Heights Christian Church Community Meal on the second Saturday of each month. It's open to all. It's not based on income, and it's growing in its popularity and the participation of it. Thank you. I'm so sorry. The Little Free Food Pantry at Heights Christian Church is another extension of this effort. You all know about Meals on Wheels for homebound seniors. The food bank at the community of church of Shaker Heights, otherwise known as the Church with the Red Door, that's located on the corner of Lomond and Sussex Roads. We also have the Getaway, which I'm going to let Trey tell you about. It's his initiative, and it's been very successful. Campbell Court is one of our two subsidized housing buildings. It's on the corner of Van Aken, and you can see it right out that window. It's the brick building that stands 6 stories tall behind the Kingsbury building. And on the second Saturday of each month, at the first Tuesday of each month during the summer, the Cleveland Food Bank has a food distribution at, I believe it is out in the parking lot, or at least in the main general area. And again, it's open to all. STC Regional Transport, that's the van that goes, that takes seniors wherever they need to go. The seniors being defined as anyone over the age of 55 that registers for the regional program, which we support with your tax dollars, can go to the food bank, other food distribution programs, and locations where food is available. And I wanted to just also elaborate that the city has a part-time social worker, Ellie Goldstein, who's just a wonderful person. And I contacted her to try and understand whether, what the dimensions she felt were of the food insecurity in Shaker. And she said that unfortunately seniors are very, they will disclose some problems and not others. And food is one that comes very seldom to her. She believes it's much more prevalent than the calls that she gets are. She refers people to the Jewish Community Center hot lunch program for $2 a day, every day of the week except Saturday. It's open. It is not income eligible. And they also have other programs there that are social programs for seniors and other people. And she believes it's very, it's a great resource that's underused in some areas. The other thing I wanted to say was that she believes that I just want to say this about the seniors that I work with. As you, and I'm experiencing this, as you age in place, and as the years go on, you pride yourself on the same intellect that you always had. But in truth, there are some things that change. And one of the things that I notice about my friends who are aging in place is that sometimes mental acuity is one of the things that slips. And although people may have an income sufficient to provide for their needs, what happens is without the mental acuity, they often don't manage their financial affairs well. The city has responded with a program called ESOP just this year. I've forgotten what the acronym stands for, and I'd probably mangle it if I tried. But what it is it's an attempt to try and help seniors that are in these difficult financial circumstances from losing their homes to mortgage foreclosure. But what they do is they invite seniors to workshops. They learn about their needs and then try to coax them and get them to open up and come to reveal and accept help. So most of our attempts within the city are attempts to open the door to conversation with seniors and then help them to access the regional and local assists that there are for food. So with that, I'd just like to say, to turn the mic over to Trey, who's been very involved over the years in this.
Thank you, Nancy. Thank you to the League for putting this event on. Thanks to all of you for coming out. I understand you haven't had the most fun weather day here. And I want to thank my colleague, Nancy, for stepping in also. My flight was delayed. I expect that is related to the weather that you've had here, why we ended up coming in a little bit late. Nancy mentioned the getaway. It's something that many of us worked on. Nancy was involved in many, many meetings. As I look out, I see some of you here who were involved with that as well. This community had been working for about 2 or 3 decades to have a teen center. We knew that that was a gap, and we were finally successful in being able to address that. So we now have a center that's open to any Shaker Heights High School teen. They can go there after school, and we offer free meals as well. So that's just one of the many things that the city's doing that fit into that. The only other thing that I'll add, and then I'll hand off the microphone because I don't want to have us capitalize on the time here. I know you have a lot of very knowledgeable people here at the panel and in the audience, is that it's important to talk about what the city's doing, what the school's doing, what the library's doing, and so on. I think it's even more important to talk about what we're all doing together. This is our community. We have 5,000 people in our community, according to the data that we all just saw, who have food insecurity. And that's not acceptable. And the way that we can address not only this issue, but others like it, is by creating wraparound services, by saying that it's important to us as a community. And we have a forum to do that. Was anyone at the Forward Together discussion last night? So that's a forum that's been put in place to have this kind of conversation. Yes, Forward Together is about capital planning specifically, what buildings should be and where the walls should be and all those sorts of things. But more importantly, we're asking the community to engage in a conversation on what is our vision for Shaker Heights. That's what drives the Capitol. So if you come to those sessions, or if you didn't make it, there's an online survey that will be available until June 23rd. If you put in there, I want my community to address hunger. I want my community to address literacy. I want my community to address whatever those things are that are important to you. Then we figure out what our capital plan looks like that's going to make that happen, what our facilities need to be, what our buildings need to be, what sort of infrastructure we need to have. And that's how we can come at this. We all have programs, there's many very good programs, but we're even better when we set our mind to it and we work holistically across all of the different opportunities that we have to address this.
We mentioned that there are some other programs in the city of Shaker, and as I mentioned earlier, Keith couldn't be here. We've got Amy, who's going to talk about the Little Free Pantry, and then I'm going to have Stacy, if you could just share some of your experiences at Onaway, and then Nikki's going to talk about what's going on in Heights Christian, and keep passing your questions up, and we'll continue to answer questions. And I will, if there's time at the end, I'll just hit a few of the points that Keith gave me, but if not, then I'll give you his email and you can ask him directly, okay? So, Amy.
Thank you, and I'm just going to move over here. I have a few notes on the computer that this will work a little better, I think. Hi everyone. My name again is Amy Bouthelette. I am one of the co-founders of the Little Free Pantry of Shaker, along with Katie Hawk and O'Brien, who unfortunately couldn't be here with us this evening. But the two of us together, food insecurity has really just become a passion project for us. A couple of years ago, when our kids entered the Shaker elementary schools, and we started to see the need and the disparity within our classrooms. And around that same time, we heard a segment on the birth of these little free pantries that were starting to pop up in other parts of the country, and immediately thought that this would be a perfect thing to bring to Shaker and our own community for a couple of reasons. One being because we knew there was real need and not enough support currently in place to help the numbers that we're hearing about from Loren and Kim, et cetera. And secondly, because Shaker we really felt would be ripe for this neighbors helping neighbors concept, which is what the pantries rely on. I'm sure we've all seen and experienced in some capacity the generosity and goodwill of Shaker and the community, and so we really wanted to tap into that. It can be challenging also to find ways to get kids in particular involved, especially in real and tangible ways, and so the Little Free Pantry is one way we felt to really help bridge the need with the desire for people to help in a really easy and meaningful way. And we've seen that come to life here over the past year. So we brought forth our idea to Keith Langford and to Trey Roeder, who were both extremely supportive of our vision. And then Trey was then our liaison and worked tirelessly to support and help get the necessary approvals with City Council. And so then in May of 2018, we opened the first location of the Little Free Pantry of Shaker over at the Heights Community Church, which I think Nikki will talk about. Again, Pastor Roger, Kate Galuli, and the whole congregation there has been extremely supportive and helpful in getting the pantry launched. And in a couple short months, hopefully later this summer, possibly early fall, we're looking to now launch a second location over near the new Van Aken district. So we will have a second location here coming relatively soon. Just to give a little more background on the Little Free Pantries, for those of you who may not be familiar with them, they're very much like the Little Free Libraries that we're probably all familiar with, but instead of books, they stock non-perishable food items and personal care items. So it's really meant to be a supplemental safety net. It's not meant to replace a food pantry or any other resources that are available to individuals in need. It's really meant to supplement. And there's a sign on the structure itself that says, take what you need, leave what you can. So there's, that's it. There's no paperwork involved, no qualification process. It's open 24/7, so whenever there is a need, someone can come access it, and hopefully there'll be something there to help carry them over. We're very much a grassroots effort, including getting word out and communication on it. But within days of the pantry opening, it was being extremely well used and continues to be. Most things, when they're put in there, don't last even 24 hours. So there is a lot of turnover, a lot of inventory goes through the pantry. And I just also wanted to say the community has been really very receptive and supportive. So we've been partnering with both Shaker schools, some organizations like the Cub Scouts, Daisy Troops, et cetera, have been helping to keep the pantry stocked, helping us do some food drives and things like that to supplement our supply, because the demand has been so high that it's hard to just rely on neighbors. And we've been working with some of these partners to help generate more food. So we haven't been here, and again, I mean, it's very much a neighbors helping neighbors concept, so people can drop off at any time, pick up at any time, and you know, it's also anonymity is a big plus with this. You don't know, as you know, someone's approaching the pantry, you don't know if someone's dropping off or picking up, and we also chose to place the structure toward the back of the church, not right on Van Aken, you know, just so it wouldn't be quite so prominent, but a little more discreet in the back of the church. And so we're doing a similar assessment as we look at the new location at the Van Aken district to try to do the same and make it tucked back a little bit. So I think that's it for the time being, and then I'd be happy to take questions. Nikki, you want to go next?
Hello, good evening, everyone. I'm here today on the behalf of Heights Christian Church, and hey, how you doing, Annette? And I'm here to talk about our community meal that we do every third Saturday of the month. Yes, every third Saturday, so actually we'll be hosting one this Saturday coming up on June the 15th. It's from 12 to 2. It's from 12 to 2, and basically, it's for everyone. All are welcome. It's free, but it's a little different. It's not like your traditional, you know, you serve the homeless. It's not the traditional stand-up line, you know, we serve the homeless. It's kind of different. What we wanted to do was we wanted to build community. So we wanted to have everyone involved, not just, like I said, the homeless. We could have people there that are homeless, but also who might be financially, you know, fluent as well. So basically, there are a lot of people who don't, you know, have family. They don't have, you know, a lot of people to talk to. So I find myself even there, you know, because I'm there maybe from 10. It doesn't start to noon, because a lot of time I'm setting up. And I find myself still there at 2, don't want to leave, you know, because everybody's having such a good time. They're congregating. It's just a great place to be. And of course, you're going to get a hot meal while you're at it. Also, what we like to do with our building our community is not only are you eating, we have like a little sign-up sheet when you come in. You could help set up. You could help prep the food if you would like. You could help, you know, there's a lot of older people that come from Campbell Court, so they might need assistance. They can't get up. You know, they might want their food served. So you could help with that. Also, you could help with the cleanup as well. So basically everybody, you know, they have a part in it. It's just not, you know, we're here to serve, but not, you know, that type of way. So everybody feels important, you know. Yeah, like I said, it's every third Saturday of the month, and it's always a nice hot meal. And a lot of times we have a featured chef as well. They like to give their time. Like last month we had tacos. So it was really, really nice to, you know, they always switch it up. So it was always really nice. And I'm trying to think, is there anything else that I'm missing? Yeah, so just come and, you know, see what it's about. And there are a lot of neighbors that walk past each other. They don't know each other. Now they do, because they see each other at the community meal. It's a good time. Yep. So if you have any questions for me, you can ask at the end as well. So.
and Stacy Wren is a, I'm putting her on the spot. No, she is a wonderful volunteer here in Shaker, and she's worked at Onaway School. She's done some work at Onaway School. And we had the wonderful opportunity to meet her a few years ago when the food bank helped her with a program over there.
So I'm just a Shaker mom with 3 kids in the school district and was doing a lot of the micro level work, particularly at Onaway School, along with Amy and some other parents, to respond to what we saw was a definite need in our lunchrooms and breakfast rooms at Onaway. So we were doing things like sending home food in anonymous backpacks on Fridays. We were packing up leftovers from the salad bar on Fridays and sending that produce home. And that work, as Amy so beautifully shared, evolves over time. And it's hard to not stop thinking about what else there is to do. So when I became part of Community Builders, which is a subset of PTO, those are groups at every school, Community Builders across the district and at each individual school is charged with honoring all forms of diversity in Shaker schools and lifting up each other, to care about each other, really under the auspices of Martin Luther King's vision of a beloved community. And if you're curious, I would direct you to thekingcenter.org to read all about that. It's really inspiring. So as part of that work, along with Roxanne Jaber and Yvette Reynolds, the 3 of us we took on the Community Builders role for the school district 2 years ago. And part of that work was the planning of the Martin Luther King Day of Service in January that continues. Please come to the high school if you're available. It's really worth it. And during our time in that role as community builders, we ended up talking a lot about hunger. And so we piloted 2 community markets. I'm sad to say they have not carried on, and I hope they will. I'll talk about that in a minute. But just very briefly, we wanted an opportunity to bring neighbors in Shaker together in the fall when school was back in session, like we had done around Martin Luther King Day. We wanted to give folks access to produce, and so we did that in 2 different ways, which I'll talk about in a minute. But imagine, if you will, the farmer's market at Shaker Square on the green space between Onaway, Woodbury, and the administrative building. So we set up a bunch of tents. We made this free of charge. We partnered with the library and the city to offer free produce. We had cooking demonstrations by local chefs, by Edwin's, who partnered with us for one market. And then we provided a number of community resource tents so that folks could tap into anything from scouting opportunities, the library, the nature center, the historical society, scouting. We offered yoga. The library had read-alongs for kids to do. And it was really a beautiful effort around community building and then, again, caring for each other. Where food insecurity comes into this is that it was really important to us to offer anyone who showed up at the market on those 2 evenings the opportunity to take home a bag of produce. And so the first time we partnered with the food bank, and that was glorious, the Youth Ending Hunger chapter at the high school unpacked pallets and pallets of food for us on the parking lot between Onaway and Woodbury. And we gave almost all that food away. What wasn't given away was taken to local shelters. I will say there are so many opportunities for learning and doing this work because of the qualification guideline around being at 200% of the poverty level. That makes it tricky around who is comfortable receiving food. And so the second time around, in October of last year, we were able to purchase with Community Builders budget money and some additional funding from the school district, food from 3 local farms, Rainbow Farms, Wolf Farms, and one other I forget, but please patronize, give them your business at the farmer's market on Saturday. They sold us thousands of pounds of local produce below wholesale. So at that market, we were able to give everyone a bag and invite them to fill it, and then taste a soup that had been made with the very ingredients that were being given away that day. So those are the community markets. They grew significantly beyond volunteer capacity. That is the honest barrier to those, but in my heart, I hope that we can revisit them in the future and see how that partnership may continue. Thanks.
Keith gave me a few pointers that I'd like to read, and I probably can't answer questions because they're about the schools, but I'll give you his email. But one thing in particular he wanted me to mention about the Shaker Heights Family and Community Engagement Center, and better known as FACE. And FACE has created partnerships and collaborated with a variety of community partners, organizations, and parent groups, including the PTO, to provide students and families with resources and information that build capacity for success. The FACE Center collaborated with the PTO to host the first district-wide free community meals event and provided families with free produce, meal tasting, nutrition information, and resources to find local food banks and pantries. And that's what I think Stacy was referring to. A partnership with Heights Christian Church and others has brought to Shaker residents monthly free community meals. The FACE Center also hosts a link on the school district's webpage that shares quick links to the Greater Cleveland Food Bank, 211 hotline for community resources, and children and family services. Additionally, FACE sends information and resources home via putting it in the kids' backpacks and emails for those with home computers or internet, and shares information using social media. So there are a lot of opportunities, there are a lot of resources in the city of Shaker, and we thought this was a great topic for tonight because it's the beginning of summer, school's out, a lot of kids don't have access to the free and reduced lunches at school, so there's resources, there's information back on the table with different programs that are happening in and around Shaker. There's information about the food bank, there's a variety of different things that there. Please help yourself. And I know some questions came up, so I'm going to ask the speakers if you could answer, if you can, the questions, because some of the questions there may not be answers to, but they'll try their darndest. So who wants to start first? Kimmy?
There's one food bank specific, so I can
Okay.
do that one. So this is a great question. If farmers have a bad crop, how does that impact the food bank and hunger? So we are very much impacted by what's going on a national basis. I don't know what you want to call it. So if there's a season of maybe low crop yields from, I can't think of an example in my head, but you know what I mean. So we definitely are impacted. I almost think it is more of the opposite. So sorry, I'll stand. I'm short, so you probably can't see me if I'm sitting. There is a program that the food bank gets food from, and that's the reason why we have that 200% of poverty guideline. It's not because we have chosen that guideline, it's because we get food from the Emergency Food Assistance Program called TFAP. It's a program with the USDA, and that program purchases surplus crops from farmers. So if there's a huge crop season, a few years ago we got a ton of catfish and blueberries, peaches, things like that. If there's something going on in the economy, we can get that food. This year it's been pork, milk, things of that nature. So it depends what's going on in the economy, what's going on with the weather. A few years ago, there was also a huge drought out in California, although we hear that on probably an annual basis. So we got a lot of beef from that huge drought that happened. So we rely on those kind of the changes in the agricultural community. That's something I do not understand farming science and everything that goes into it, but I can definitely tell you that our food is impacted by the need in our community from federal government food that comes to us, but the other thing is supply. So we may get a ton of one type of product, and it's all based on what's going on.
I have a couple more that sound like food bank questions, Kimmy, so keep standing. Someone asked why the 6 counties on the map, especially since the southern 2 are not contiguous with the other 4.
That's another really good question. I think we get that every time I show the map. So we serve all of those 6 counties. There is actually a food bank that serves every single county in the United States. So there are about 205 food banks nationally. We're all part of an umbrella organization called Feeding America. In Ohio, there are 12. So although we skip right over Medina, that is served by the Akron-Canton Food Bank. So they are closer to that Medina area. We, in the past, we served west of 71 in Medina, and Akron-Canton served east of 71 in Medina. It's kind of like one of those old tales at the food bank. No one knows quite what happened, but all we know is that Akron-Canton Food Bank now serves all of Medina County because logistically, it just makes a lot more sense for one food bank to serve an entire county. So Yes, that is why we provide food in all those areas. And in Ashtabula, they're so huge and the need is so high out there that they have an entire separate partner distribution center. It's like a miniature food bank. So we deliver food there, and then they distribute it out to about 20 or so programs in Ashtabula County.
And here's another question. I don't know if it's Kimmy or Loren, but it's what programs are in place to help people who don't qualify for food assistance under the federal guidelines? And are there empowerment strategies for reducing poverty? That could take us for weeks to answer that question. But you guys know of any other programs that if they don't qualify for food assistance, what programs might be available?
So I'll start just by saying food banks are almost in, we have that 200% of the federal poverty line guideline, which is different than what you need to be eligible for food stamps or SNAP. So SNAP is 130%, so it's quite a bit lower. The 200% number really incorporates the fact that there are so many people who are working that still aren't making ends meet, and it also incorporates a lot of seniors who may be getting Social Security. It puts them within that guideline. So food banks are almost the response to the fact that a lot of folks are not eligible for SNAP if they're working. Although there are a lot of, most people that are on SNAP do work, but there are a lot of people who are still struggling. And if you're at 131% of poverty or 132% of poverty, you're not eligible. $1 or $2 in a raise could bump you off the program. So I would say food banks are almost that response. When it goes above 200% of poverty, I'm not as familiar on that. I don't know if, do you know of anything, Loren?
It's just emergency food at that point.
Mm-hmm. Yes, and programs that aren't affiliated with us is where you'll find more flexibility. But since we go by federal guidelines, we have to stop there.
I'd like to comment on the question, what can be done to reduce poverty? And yes, to Mary's point, that's a very long conversation, but there is one specific thing that we can do, and that is public transportation. People, especially in this economy right now, we have a lot of jobs that are unfilled in our area, and if people don't have the means to own a vehicle, public transportation is how they get there. In this state, we fund public transportation at one of the lowest levels of any state in the union. So what we want to do here is we don't want to do a better job feeding hungry people. We don't want to have hungry people. We don't want to have people with food insecurity. And I appreciate the question very much because that's where it's coming at. How do we get at the root cause? So just one of the many answers to that is support public transportation.
Any other questions or more comments?
One small comment on that. So with our help center, the phone number that I had there, that's something that we're really trying to get more involved in. We don't want to help provide medical care because we're a food bank and we're not experts in the medical care world. We don't want to try to provide employment services because, again, we're not experts in employment and resume writing or anything like that. But we do have partners. So if people call our help center if they're going through a tough time, we can help them get connected to those partners that have been doing it for a long time and that do it well. Health, transportation, housing, and medical. Yeah, I said health. And employment. So those are kind of the big partners that we have, but we've kind of accumulated a list over the years. So that's another kind of plug for the Help Center if you know of anyone who's struggling. Because as you said, if you can eliminate all of those things, our goal is to put ourselves out of business at the food bank. We don't want people to have to come to food programs at all. So yeah, just wanted to make that.
And one other thing about the Help Center that's really great, if you know seniors, sometimes they're homebound seniors, or they can't get out or they're afraid to get out, they don't know where to go. They call that number, the people that are answering the phones can help them, here's a place here, help connect them. And I know that at times they've been able to call other people in the community to help them out. So that's a very important number, especially if you know seniors who are afraid to get out or are homebound, and they can help figure out how to get them food. So, Loren, you got any questions there?
Sure, I got one really straightforward one.
Good.
$18.20 a year for seniors home delivered meals. Is that for 1 meal a day or 3 meals a day? It's 1 meal a day. So that's less than $5 per day, and that's all the fixed and variable costs of delivery, insurance, the driver's salary, the meal itself, the container, the refrigeration. So less than $5 for a meal a day is pretty cost effective. So hopefully that answered the question. This one I think is good for everybody here, but looking forward, as boomers get old, how will we handle their food needs 10 plus years from now? So One thing I want to highlight is the fact that the fastest growing demographic in the state of Ohio are the elderly, folks who are over the age of 50. There's a lot of research out there about how this might affect the social safety net, how this might affect the economy, generally speaking. We worked with the city of Cleveland and produced the Age-Friendly Cleveland Report, which basically was a broad survey distributed to thousands of seniors about what they expect in terms of the city. I would like to underscore what he said about public transportation. Walkability can be seen as something that's complementary, something like food insecurity, because a lot of barriers to accessing some of these services are as easy as there's no bus near my house, or rather, I can't cross the street, or rather, we don't have regular services for something like senior transportation connection. So I'd just like to highlight that. But so that's some of the policy angle, but I'd say just two things. On policy, number one, weigh in. I think what's happening a lot when it comes to social service programs generally in the United States from a policy standpoint is there's a lot of erosion taking place. If you look at the industrialized nations across, across the globe and how much they spend on healthcare versus how much they spend on social services, we spend the most on healthcare and the least on social services. And the two are obviously interrelated. So I would say, first of all, if you don't get involved in the public policy process or talk to your elected officials about these sorts of issues, remind them, that something like SNAP matters to you, that you're supportive of it or not, or just get involved in the process. The ballot box is a powerful thing. I'd say the second thing is cultural. Part of the thing here, particularly with the elderly, is that there's this stigma around SNAP and around food assistance and that sort of thing. And I would say that, these programs are, it's sort of like the unholy alliance around the Farm Bill. Farmers are getting paid for this, right? And this is just food that would otherwise go away. And it also saves money in other parts of, our delivery system. We talked about the cost effectiveness of something like home delivered meals versus inpatient admissions. I would argue to say to anybody who might be suspicious of that or who is concerned about the taboo nature, it's so endemic. It's so real. I've been in food insecure when I was at Fernway when I was a kid in fourth grade. I very vividly remember taking someone's stamp off the back of their hand to try to get free pizza, and then crying to Mr. Cannon, who was the principal at the time, basically saying, like, I feel bad, I think I just stole pizza. He's like, I got you covered, don't worry about it, right? Food insecurity is not something abnormal, and I think what people don't understand oftentimes is that poverty is often temporary, or it might be in flux where people just kind of hover in and out, and for seniors in particular, they're living on limited budgets. This is a way to supplant a budget so they can stay in their homes, so they can receive services in a cost-effective manner. So I would say, let's get rid of the stigma, let's get rid of the taboo nature of it, and encourage people to speak out and access these services. That'd be huge.
One more question here. Food insecurity in school-aged children. Is anyone looking into the correlation between state report cards, testing, and populations of students eligible for food assistance? Is there any data available? Loren's shaking his head yes, so that's...
Yes, a hungry kid is a less prepared and enabled student. If you are hungry in the middle of the day, there's all sorts of research, both sort of experiential and also measurable, like neurological-based data that says if you're hungry, you're not going to be as cognitively equipped. And so that means food insecure children also face a greater risk of greater economic insecurity later in life. They're less likely to graduate high school. They're less likely to go through college. They're more likely to be dependent on social service programs in the future. So if Shaker is at schools, which is what I hear, food insecurity is a key educational strategy.
Okay. Any other questions that aren't written down on cards that you'd like to ask that for the panelists?
One more,
Oh.
but I think this might be a good one for you, Loren. How do we reconcile growing obesity rates with food insecurity?
Oh yeah, how do we reconcile growing obesity rates with food insecurity? Well, I think it's the type of food. First of all, unhealthy food tends to be more readily available and less expensive. Also, when it comes to food security, I think one of the things is cultural appropriateness. So I know Metro has a program with the food bank, and part of what they're doing is trying to connect the physicians with nutritionists who know how to work with people on their traditional diets, right? So if someone eats a lot of bread or sugar or something, they can say, hey, here are some good alternatives for you. so you can maintain these practices, right? So I think obesity, you know, for me, like that $2 pizza was a lot cheaper than trying to, you know, procure like, I don't know, like fresh avocado and grapes or something like that, right? So I think part of it's cultural, but a lot of it's just about availability, accessibility, and cost.
I think that fresh produce is something that people want. The last time that we really spoke to the people that come to our programs, the most requested item was fresh fruits and vegetables. It was almost 60% of people asked for that, and that came before meat, which was a huge thing for the food bank because that is always the #1 requested thing, is meat and bread. But fresh fruits and vegetables came before that. So I think that really just speaks to the fact that so many folks that come to our programs and they get that fresh produce, it's not because they don't want to buy it at the grocery store, it's because they can't afford it. And I also think that ties into if you're only getting $1.40 per person per meal through SNAP, then chances are, you know, as a mom, I'm gonna buy 3 boxes of Kraft mac and cheese to last me 3 dinners compared to like 1 apple. I wanna make sure that my kid has food to eat, and that's just common economic sense. So I think making sure that SNAP is not just a supplement, that it actually goes a little bit above that and we can increase the amount that people get on the SNAP program, I think would make a huge difference. And it also, I mean, we want people to be in grocery lines, not in food program lines. And if people aren't getting SNAP, you know, for every 1 meal provided by food banks, 12 meals are provided by SNAP. So just because people aren't getting SNAP anymore doesn't mean they're magically not hungry. That means that they're coming to our programs instead. So they're moving from food grocery lines to food pantry lines. So increasing the amount of SNAP benefits means that more grocery stores are open, they're able to stay in business, they're able to employ the truck drivers that drive that fresh produce, the farmers. It just makes a lot more sense.
I think it would be a great idea for the League of Women Voters chapter in Shaker Heights to consider something like a food stamp challenge and live this out. Because I did it with our students, it was nearly impossible to follow the dietary guidelines that are prescribed, unless you really, really like ramen.
Well, I think it's getting, oh, go ahead, another question.
On the school base. So you said Beaumont had 46%, which wasn't quite to the 50%. Do we think that the population isn't all applying for it, so we could be over that 50% mark? Or is that we've reached our max and we weren't there? Should we be encouraging families to apply versus not saying anything?
That's a great question. I think it's hitting that max. I think what is happening, there are more than enough kids. So the part that I find very frustrating, so when you looked at that slide, it was like 1,300 kids in Shaker Heights are in need. It's just that geographically, they're not all in the exact same area. This is it's something that we see in a lot of suburban areas and something that is even more of a challenge in rural areas where kids can't get to a site and they're so spread out that we can't open these food programs. So I think it's just a matter of those 4 percentage points not hitting that number. There's different ways for the state to count things. There used to be a different way that the state determined what site was eligible to serve after school and summer meals, and they just changed it this summer, which limited access quite a bit as well. So there's things that have been going into it. But like I said, so the legislation I talked about, kind of mentioned before, it's called Child Nutrition Reauthorization. And all it would take is moving that. If we could make it 40% of kids are eligible instead of 50%, we would add thousands upon millions of kids across the nation would be able to access food. Or if we could I could go on for a while, but yeah.
All right, this is kind of the end. So a couple things. One, I'd like to not only thank the panel, but thank the members of the audience, Nikki, Stacy, for participating, because there's a lot of things that are happening here, and if we don't talk about it, we don't know about it. And if we don't know about it, we can't do anything about it. So I think that's really important. And then call to action. I think every one of these forums should end with a call to action. There is a form back there that Kimmy mentioned in terms of advocacy. We need advocates at the food bank. We need advocates for the League of Women Voters. It is really important that our voices are heard and that people in Columbus and in Washington know that we care, that we're concerned, and that we're watching. So please sign up. There's information back there on the food bank. We have 18,000 volunteers. We'd love to have 18,044 because there's about 44 people in this room. You cannot imagine what a volunteer at a food bank does. It is just, we've saved like $1.5 million last year because of the number of volunteers we've had so that we could put more money for food instead of more money for packing and sorting and those kinds of things. We also have information there about various pantries around the Shaker area if you need that. There is information there about the League of Women Voters, who is the co-sponsor of this forum. Join the league. Be more active. We want more members because it's just like you said, we should be more active. We are living in probably one of the most active communities in Northeast Ohio. So join the league, consider membership, and consider volunteering for the food bank. And one other pitch for July 25th. The league will be sponsoring a forum on domestic violence. There will be more information coming about that. So thank you very much for coming, and thanks to the panelists and to our participants.